Health experts in Japan have agreed to downgrade the status of COVID-19, reclassifying it into the same category as the seasonal flu. The change will take effect from the 8th of May. Prime Minister Fumio Kishida's government says the move will allow for the easing of COVID curbs, paving the way for normal social and economic activities to return to Japan. CNA's Minister Kishida has more on what the downgrade means for businesses and individuals.
The relaxation will take place later than expected. With a downgrade, emergency measures such as movement restrictions and calls on bars and restaurants and other establishments to be shut will no longer be used over COVID-19. Prime Minister Fumio Kishida had previously said the government aimed to downgrade the category in spring, prompting many to assume March or April. He told his cabinet ministers on Friday that the decision to do it in May will allow the nation more time to adapt to the transition. The relaxation will now only take place after the Golden Week, a week-long break which coincides with 4 national holidays in Japan. While COVID-19 cases are falling, the number of deaths is still high, hovering around 400 a day. If the easing happens too fast, experts fear there will be another spike of cases. Regarding mask wearing, Mr. Kishida said he will leave it up to individuals to decide whether or not to wear masks outdoors and indoors. But the government will issue a guideline to identify circumstances where mask wearing will be desirable. According to a poll conducted by Fuji TV over the weekend, most people surveyed do not want to take off masks indoors. Vaccination will be continued in the meanwhile, but the government will decide in April whether to continue subsidizing COVID jabs. As to COVID treatment, whether the government will continue to fund patients will be decided in early March. Michio Ishida, CNA, Tokyo.